But we are here to make sure that every American that wants health insurance can get it. You have until March 31st to sign up. But for too long, our healthcare system really has been broken. Insurance companies often denied coverage to people with pre-existing conditions, and millions of Americans simply could not afford to get care. Today, we will hear why Americans are happy to close that chapter in the history of this country and to take ownership of their own health. Gone are the days of the annual limit or a lifetime cap on health coverage. The Affordable Care Act was created so that every American had access to affordable health care, because every American, no matter what you think, needs health care just about at every stage of their life. And thankfully, in the state of Ohio, Medicaid was expanded so that 275,000 more Ohioans would have access to affordable health care. More than 2.7 million people in our state have insurance that covers at least one preventive service, such as a mammogram or an immunization at no out-of-pocket cost. And nearly 97,000 Ohioans have already enrolled, which is about 85% of those who were qualified, who went online, 85% were qualified to enroll. And our goal today is to help the young people who are 26 and older, who we all know do procrastinate a little bit, and the people who may not realize how easy it is to sign up. We're going to help them enroll today. Anyone who does not apply by March 31st, so that everybody is clear, will have to wait until the next open enrollment period. Now, I know you've been hearing on the news that it has been extended. In fact, it hasn't. It's no different than if you get to the voting place at 5 minutes of 4 and the polls close at 4 o'clock. If you're in line, you get, no matter how long it takes, they let you vote. The same thing here. If you're already in the queue, if you've already gone online, if it takes up another week or two, you are still eligible. We have not extended the deadline, so don't let people tell you that. The Affordable Care Act is already making a positive difference in the lives of people in our community. Let me share with you one example. A constituent of mine called the office to sing the praises of the Healthcare Act. Brandon from Shaker Heights, who's a young man who went to Healthcare.gov the very first day, which I know had to be a nightmare, the very first day it was available and signed up for Medicaid. Now, we know all of the problems that happened with the rollout. All those problems have been fixed, obviously. We've got a website now that can accommodate as many as 1.8 million people a day. But anyway, he went online, and he never heard anything, of course, because the system wasn't working properly. Shortly thereafter, he realized that he had to have his gallbladder removed because he had gallstones and he was very, very ill. That surgery cost him more than $40,000. He had no idea how he would pay for it. This is a guy that's healthy. Didn't drink, didn't smoke, worked out, a healthy guy. And so he went to one of our community health centers, of which we have many great community health centers, for low-cost care. And the center actually helped him to go back and kind of expedite his application. They were able to get him signed up retroactively so that he didn't have that $40,000 debt. So all he was going to have to be responsible for was some small charges, which they reduced those as well. So we know it works. We're here at MetroHealth Centers because of the tremendous outreach and the leadership it has provided to get people covered. They have their own program, of which I am most proud as well, that they started when no one else thought this could work. MetroHealth did. They had a vision that most institutions did not have, and they started signing up people in a different kind of a plan. More than 27,000 people have already signed up in that plan alone. So I want to, at this time, bring to the podium, but as well as to thank Dr. Boustro so he can explain how the program works. And I want to thank the staff and all of the physicians here. Dr. Boutros, thank you so much.
Well, thank you very much, Congresswoman Fudge, and it's a real honor for us to host U.S. Representative Fudge and Labor Secretary Perez for this timely and important topic. Making sure that everyone in our communities has access to health care. MetroHealth has been providing health care to this community for 177 years. Same year Cleveland was incorporated, MetroHealth was started. And we know through that long period of care, we know that when people don't have health insurance, they don't get the care they deserve. They wait, they prolong, they hope that things are going to get better, and often they don't, and they have to come in. And every emergency that comes their way becomes a life-altering event, sometimes throwing them into bankruptcy. So these are things that we need to be able to, as a healthcare system, to combat and to provide the services for them. Our goal is to provide easy access for people to get into the healthcare system. Congresswoman Fudge mentioned our Metro Healthcare Plus program, which was our Medicaid waiver program. We delivered care to over 32,000 people during the year, but we finished the year with 28,000 folks that we took care of. And uniquely at MetroHealth is that we had those patients as patients, most of them as patients before when they were uninsured, and now know how their care changed when they became insured. Really surprising to many folks, but not to us, their health care improved. Their outcomes in diabetes and their outcomes in hypertension improved. We will hopefully be presenting a study with Better Health Greater Cleveland demonstrating this unique opportunity to care for those who are uninsured. We also often, the public makes the mistaken assumption that folks who need help with Medicaid and Medicaid expansion are chronically uninsured. We know that's not the case for many of our folks who became eligible. Today you're going to meet Lori Smith. She, with her husband Patrick, became early insureds of the Metro Healthcare Plus program. They were both healthcare workers who lost their jobs and for a very short period of time were uninsured and needed the Metro Healthcare Plus program. I think you will hear Lori's story of our husband Patrick coming into Metro Health, and she didn't have to only worry about the health care of someone she loved. She also, when she was going home, had to worry about how are we going to take care of this. Through the Metro Healthcare program, we were able to relieve at least one of these burdens for her.
But my husband and I, like Dr. Boudreaux had said, both were healthcare workers. We were working at the time. And my husband went in for just a regular, so-called regular, knee replacement. And 3 days later, he was told he had MRSA. He went through several surgeries trying to save the leg, actually 13 of them, until 2 years ago, Easter Sunday, he came down. He was septic, and I had him rushed down here because through that time, we lost our insurance because we were told that my husband did not return to work in a timely fashion because he was in the hospital with these knee replacements. So we ended up here at Metro. I was like, what kind of decisions do I make? What do I do for him? I knew I had to do something, but what? How do you face that kind of situation when you're told, well, if he doesn't have the leg amputated, he won't make it. And I'm thinking to myself, but, having worked in the healthcare field, I know the cost. What do we do? Of course, it was, no decision on my part. We're going to save my husband. So we were introduced to Dr. Brendan Patterson, who, bless his heart, saved my husband's life, as far as I'm concerned. And we went ahead with the surgery. But prior to that, the actual surgery date, we were introduced to a young woman named Megan. She came up to my husband's room and told us about Care Plus. And that was probably the biggest relief I had ever felt in my life, because now I knew, I felt fine that Patrick was going to be okay with Dr. Patterson. And now I knew he was going to be okay, being covered. I mean, because through this time of going through these surgeries, and we, I guess I'm not ashamed to say it, but I sold my car so I could pay for his medical bills. I sold my wedding ring, so you do things you have to do. And then we found Care Plus. So it's been wonderful. I mean, my husband has had issues since because of the MRSA. He has Klebsiella, Pseudomonas. So anytime he gets a cut, bump, a bang, he runs the risk of another infection. And that's sort of where we are today. We think he has pneumonia. So, I'm incredibly worried, but I know he's going to be okay because, one, he's here at Metro, and two, I don't have to worry about that extra bill, and I don't know what we would do without it, but thank the good Lord, we happened upon it. I do know as far as for us, our situation may have been a little different because, having worked our whole life, we had no idea that it was available. You're supposed to work, you're supposed to take care of yourself, and we did. And then we had this catastrophe happen, and now we sort of have someone who can help take care of us, and it helps greatly. And I'm just here today to say thank you.
It's kind of impossible not to be inspired by the stories you hear. In the United States of America, nobody should have to sell their wedding ring to pay for health care. Thank you. Congresswoman, she's one of my favorite people. She's got game, as we say in the business. You got that right. I just met her mother. I know where she gets her game from. Okay? Thank you. I really did just meet her mother. I got a photo to show. And Dr. Boutros, thank you for your leadership. What you do. I've got a few admissions I got to make to you right now, okay? If y'all don't mind. My first admission is I'm the youngest of 5, and actually all my siblings are doctors. And I promised them that I would never become a plaintiff's personal injury lawyer. I kept that promise. But I've had profound admiration for the work that they do. They're so excited about the Affordable Care Act because it's enabling them to serve so many people. I have one sibling who practices in rural Texas, and so many people that he cared for didn't have access to health insurance. And he would take care of them because he understands the Hippocratic Oath, and he understands moral and ethical imperatives. And so I promised them I would never become a plaintiff's personal injury lawyer, but I did get involved in this. And my second admission is I served, among other things, under Donna Shalala when she was Health and Human Services Secretary. And we spent a lot of time on implementation of S-chip back in the day. I had hair. I had a lot more. I could run, things of that nature. And I had the privilege after I left that job of serving on the Kaiser Commission on Medicaid and the uninsured. And I applaud the state of Ohio for taking up the Medicaid expansion because it's unbelievable when I go down to places like Florida and Texas. Florida is leaving something like $50 billion on the table. I talked to Dr. Boutros's counterparts down there, and they just shake their head because you know what? It's on you. The folks down in Florida, you got to come up with it. And by the way, they're paying for it already. You know that. And you go to Texas, which is the health uninsurance capital of the United States, followed closely by Florida, and you see a similar story. And so here in Ohio, we're in much better shape. But that leads me to my third admission, which is I am a chronic procrastinator. I was the guy on Christmas Eve you'd see running out in the car, going to the store. I should have gotten presents. And it dawned on me frequently right at Christmas Eve. And by the way, you're not just a navigator, you are an angel for folks. You know that? Because the work you do is giving so many people hope. And, in addition to Lori and her husband, I think one of the happiest people in this hospital is a person who has lived entire life in this hospital, which is a triplet, who is still in the NIC unit. And you know what? But for the ban on lifetime caps, that person would probably be hundreds of thousands of dollars in debt. I can't for the life of me understand why people are so heck-bent on waking up every morning, making it harder for that family to be able to pay for their child's care or your husband's care. But I digress, because I am a procrastinator. And I'm here to tell you, I know, and I got some young children at home. I got a couple teenagers, and their motto is, why do today what you can put off till tomorrow? And I don't think I'm alone in having teenagers and 20-somethings who are like that. And that is why I'm here to say that, you know what? You can't procrastinate any longer. It's Christmas Eve here, okay? It's time to get enrolled. We got just a few days left. And we've got a website that is working quite well. We've got over 6 million. 6 million. We crossed the 6 million threshold just the other day. And it is humming. And the number of calls to our call center is record volume. The number of people enrolling is record. I spend a lot of time, I was with the president a week ago, getting updates from our computer folks on what's happening, and the wait times are short. The navigators are unbelievable. Si no puede hablar inglés, puede contactar y hablar en español. Cuidadodesalud.com. Latino enrollment is going up. Young people are getting the message, and we're making progress. Not only over 6 million, but now we got the 3 million plus who are on their parents' plans. Got folks, millions of people who signed up for Medicaid or CHIP because they're eligible. Millions of more who would have, but for certain folks who decided that I'd rather have them stay uninsured. And I'd rather be the health uninsurance capital of the United States. But we'll work on that. Here in Ohio, I think it's a good news story. I think there's a lot going on. But there are only a few days left. And I can't say that often enough, because I know I procrastinate. But you cannot, procrastinating about a holiday gift is one thing. Procrastinating about getting access to health care and having your lifeline is a totally different thing. I had an employee of mine come up to me recently and say to me, thank God for the Affordable Care Act, because we put our 24-year-old daughter on it. She was uninsured. She's one of those indestructibles. I don't need health insurance. Nothing ever happens to me. Never been to a doctor, never need to go to a doctor. And then a month after she is enrolled, she's diagnosed with thyroid cancer. Treatable, doing well, but that guy, my colleague, wakes up every day thanking God for the Affordable Care Act. And the president gets letters from people across this country every single day talking about, I've had a pre-existing condition. I've been in job lock because I had this job and I can't get out of it. And now you can, because you can't discriminate based on people with pre-existing conditions. You can't discriminate against women and charge them higher rates because they're women. A lot of hard-working Ohioans here, and you can't discriminate against someone who has a hard job by making the rates higher. That's a big deal for folks here in Ohio. And that big deal is resulting in so many people getting access to health care. This is one of the pillars of self-sufficiency. And, it doesn't take that long. We were talking before. She is so good. You get people on there, we get people enrolled, and we move forward. I am confident 6 million is not the ceiling here. We have hundreds of thousands to go. And I'm confident that many of those hundreds of thousands are going to come from Ohio right here. And they're going to come from here because of your help. They're going to come because you're getting the word out to people that, we only got a few days left, and that clock does strike midnight, and Congresswoman Fudge is exactly right. If you're in line, you get through. Just like when you're at the Target, you show up 5 minutes before closing on Christmas Eve, they're not going to kick you out 5 minutes later. You all know a little bit about waiting in line for voting in Ohio. And, You know, they shouldn't have, but you know what? Nobody was turned away. And that's not going to happen. So as long as you get here this weekend, you can get enrolled. You can get access. There's so many good things that are coming from this. We are on the right side of history. The arc of the moral universe is bending toward justice. Every single day another person enrolls. And we need your help. And I want to thank you, Dr. Boutros, because I'll tell you, I was a local elected official. So was this congresswoman. We understand the rubber hits the road right here. Because when people don't have health insurance, where do they go? They go to you. They go to you, doctor. They go to you, doctor. And I get that. And that is why this is so helpful for communities, for community health centers, for hospitals like yours, and for people across this state. So let's get folks enrolled. Procrastination is no longer allowed here in the state of Ohio or across America. Let's move. Thank you very much.